Almost 96% of healthcare leaders believe AI will give them the edge, but most don't know how to get there. 314E maps that out for you. From just in time EHR training that frees up hours, to intelligent document processing that cuts down on errors, to cloud native data warehouses and archives that secure your data. Plus, they optimize patient eligibility verification to drive better financial results. Want to lead the way in healthcare? Visit 314e.com today.
Welcome to Solution Showcase, where we explore the technologies and partnerships driving innovation in healthcare. In this episode, we're diving into Broward Health's journey to Epic and the powerful transformation that happened around a single line item, archive. What started as a standard requirement turned into a collaborative discovery that shaped outcomes, timelines, and expectations. With 314E's MuseSpell archive solution, Broward didn't just meet go live, they beat it by 2 weeks. We're going to hear how Broward Health and 314E partnered to streamline legacy data access, accelerate timelines, and redefine what archiving can do for a health system preparing for the future. And before we begin, I'd like to note that our guest, Deshan, is sharing his professional insights and opinions today based solely on his experience and his expertise. His participation and any testimonials offered are not in exchange for any promise or remuneration in compliance with Florida's ethics laws. We appreciate Deshan's commitment to both transparency and ethical standards as he shares his valuable perspective with our audience today. So, gentlemen, let's jump right in. Thanks for being here.
Thank you for having us.
So tell me how your initial conversation at HIMSS sparked the idea that archiving could become more than just a checkbox in the Epic migration.
All right, perfect. I'll go ahead and take this one. As far as archiving, Broward Health, we were transferring over from a Cerner hospital to an Epic hospital. And as part of the requirements, we would need to archive our existing systems, the Cerner and NextGen database. So as I travel out to the 2024 HIMSS Global Conference, I knew that was on our horizon of what was needed to do. So what I chose to do was just walk the actually general floor to see what the vendors were actually providing as a solution. What I did differently was I took an approach of standing in the background of when vendors were engaging with people. And I wanted to really see how they were handling themselves without them knowing I was with Broward Health. And taking this approach, as I looked at the different venues, I came across 314, and I really liked how they were interacting with other customers in order to present their product.
Yeah, I would agree. It was a great interaction. To be honest, as Deshan said, we had no idea he was from Broward, he and his colleague. And I think maybe we were showcasing MuseSpell to a few other customers or prospective customers, and there was Deshan just in the background there. And so, great kind of first interaction. And so I think it was good discussion from there. I do remember having a good sit down at the couch after we had that first interaction, though.
When we were prepping for this, you mentioned, Deshan, an aha moment during your go live planning. What shifted your thinking around archiving at that point?
So when we were initially doing our contracts and RFP, our original statement was to get a copy of our databases from Cerner and NextGen in order to import directly into the archival system. But shortly after we ratified the contract, we realized that time wasn't on our side. So we came up with the approach to go directly into our data centers and extract the information directly from there into the actual system itself. So we eliminated the requirement of getting a copy of the actual databases from the actual vendor.
And Casey, tell us about the RFP response and how it really was crafted from your perspective, because you did something pretty special around timeline capabilities and the willingness to meet Broward where they are.
Yeah, knowing, I think HIMSS was in February of 2024, and their go live was scheduled for beginning of November 2024. And talking with Deshan and the team out at HIMSS conference, they were adamant that they wanted to have their database archived at their Epic go live. And knowing this approach that Deshan talked about of going direct to the database was really the only way that we would be able to accomplish that timeline, is removing that dependency on a third party where we're waiting for backup databases and then the catch up loads and things like that. So that really drove how we responded to the RFP, and were able to accept the timelines that they had set forth in the RFP response.
And often what you find is that a large scale project like this is going to underestimate the true scope. So what surprised you most once the archive work began? And how did 314 adapt to exceed your expectations, Deshan?
Right from the beginning, our teams, we started off with a great line of communication. From our first call with their overall leadership team, everyone jumped on the call. And we removed all barriers. We exchanged cell phone information to say, hey, you have access to our complete project team. And they provided the actually same information from their side. And we realized that we didn't really have too much time to mess around. As we get to go start a project, there's a lot of introductory calls and just wasted movement. But right from the first call, we just jumped in from introductions to our provisioning meetings. I pulled my full team and 314 brought their team on, and we make sure that everyone had the access that they needed to do their job right from the first day moving forward.
I would completely agree with what Deshaun's saying is communication is key to these kind of projects or any project for that matter. And it's always that beginning starting point of getting access. It's so time consuming because we are relying on other people that are part of the team that are still busy. And I know that just in working with Deshaun and the team, he was just adamant that if you need anything, call me, text me, we'll remove those roadblocks. And so I think that was really one of the big things that allowed us to move quickly. And with, again, these big projects, you have to be able to stay on it, on point and on agenda to meet these tight timelines. And so working with Deshaun and his team and having that open communication really allowed us to work quickly.
I love hearing that because it can take a long time just to get through the contracting, security, legal risks reviews. And I'm just curious, as a sidebar, Deshaun, how much of an expectation is that from your team? Or was this more about the pressure needed to make sure you had things in place in time for go live that allowed that level of expediency to occur?
It's a mixture of both. With our as a requirement for the Epic, where we needed not just to be on November 2nd, but before that, because we had to cut over. So this was a requirement. And our leadership team, our Steve Travers, who's our chief information officer, he had to answer to our leadership and the board to say, yes, we are going to meet our deadline. So this was an important and part of the actual communication that, hey, we need to get here. This is a requirement. So it was very important that we not only met the deadline, but we actually was able to get there to test and make sure that we were good to go as part as our Epic implementation project.
And trust is one of the recurring themes in this solution story that we've been covering. I'd love to hear from you, Deshaun, how Casey, the 314E team, shifted the tone from a sales conversation at HIMSS to really discovering and solutioning in a way that met and to a degree exceeded your expectations.
I think it started right from the first conversation that Casey mentioned. Once I introduced affiliated with Broward Health, I told them, hey, this is what I'm looking for. And we just sat on the couch together. And it was a conversation of not just waiting to talk, but I really felt 314 was there to listen to what I needed, and as well as they're able to provide how they would separate themselves in order to win the actual contract, because it really does come down to on trust. Because you may have a vendor that says, yeah, we could do it. And then once you sign the contract, it's like, no, we really needed 20 weeks instead of the time frame that we actually allow. So that was really something that I really felt that from that first conversation, we really was able to have a good conversation and build that initial layer of trust together.
And Casey, trust is a two-way street. And you're obviously committing to something with the partner that's like, oh my gosh, now you're setting up the whole company to meet the timeline to do this other work as well. What was that like on your end? And how did you have the conversations internally to make sure you could deliver what Deshaun needed?
Yeah, well, I think it's from the top down here. And fortunately, our CEO, Abhishek, happened to be at HIMSS that year. He doesn't always go. And he heard directly from Deshaun and the team what the expectations were. And I do know that when we commit to something, we're going to work hard to make sure that we achieve those timelines and really make sure we have a happy customer. And that's always our mentality is we want customers for life. And the way to do that is by building trust and meeting their expectations. And so I think that was really important and expressed to the whole team from the top down from our CEO.
And then you launched 2 weeks early, which is an incredible feat in and of itself. What were some of the specific decisions or moments that you credit for helping to accelerate that timeline?
I would really say the communication between both teams at all levels. Our project management team from both sides work very well together. Our technical resources work together. Our leadership team work together. It just wasn't one level of team. It was overall from both sides. As Casey said, top down. That's how we operate here as well in the Broward Health IT department of it's just working together to keep things moving forward as things come up, and they will. How do we resolve them as quickly as possible? I give completely access to me to the 314, and they gave it back to say if something came up, I try to have that resolved within that single day. And I took personal responsibility with this project to say, you know what, I can't let my own organization down because I know we have that actually deadline. And I really felt that 314E took that same responsibility from their side as a new partner with us. And they really understand it. They didn't try to change our time frame to make their needs and stuff like that. I really think that they really took our goals and responsibilities as if it was their own.
Casey, when you think about that timeline as well, like you're like, are you tracking it the whole time? And you're like, oh my gosh, we're going to be ahead of schedule on this one. Like, how often is that actually part of the solution that gets delivered, either a bit early, right on time, and working with your team?
It's rare. I come from a project management world where this is the goal, but it's rare that projects come in on time or anything like that. So when we got sign off to say, hey, we're 2 weeks early, I think that really took off a lot of pressure from both sides because Casey and his team has to deliver a product. I got to deliver a service. So when we were able to get signed off to say, okay, it's there, it's working as expected, I think that really would give us opportunity to look back to where we started at from the first March conversation and see how far we came in such a short period of time.
Yeah, I would agree. And I think there was a few key decisions and a few things that happened that allowed us to meet that timeline. I think it ended up being 5 months that we archived a little over 100 terabytes of data between Cerner and NextGen. And really that first decision, and I think Steve came on the phone with Abhishek and just said, hey, we are going to meet this deadline. And if you tell me otherwise, tell me. And that decision to go direct to the database really was one that was key to allowing us to meet that timeline. And echoing what I said earlier is Deshan's ownership and the team's ownership of getting this done from the Broward side, really opening the communication channels, removing roadblocks really allowed us to work quickly and efficiently as a team.
And many would worry that a live data feed would create latency or other unforeseen issues in that decision. So what gave you the confidence to go that route? And how did the teams, both of your teams, manage risk while avoiding a full database copy, which is typically the norm?
Once we knew we were going forward with 314, I did work with our Oracle side to let them know this is what we're going to do. This is what the actually schedule is and stuff like that. So it wasn't a surprise to Oracle. And Oracle was good from their side, even though we're leaving their system to go over to Epic. They still assisted as needed. I had a full team that was monitoring if we went down as far as Cerner, because we are a 24/7 hospital system. So we had to have our team on full alert all around. And we didn't have any outage, anything slow us down. So when things did start, first thing we looked at it, was it something from the archival? And it was nothing from the archival side. So we didn't receive any slowdown, any major items from going with this path directly to the Ashley Center and to pull that Ashley information.
Yeah, and it helped that we've done it before, so we knew that it wouldn't bring the system down. But to Deshaun's point, we were very strategic in terms of when we would pull data, really looking at off hours and things like that, and really just make sure we monitor very closely if there were any bandwidth issues.
Having a clear schedule of when we're going to turn it down and when we're going to turn it up, it allows us to manage it as well. So if things are happening outside of that, things are slowing down, we could go to 314, say, okay, what are we pulling? Is there anything from your side? And they say, nope, everything looks good. It's still having that trust and communication with your partner to go through this actually process. And if things come up or things not looking right, they're able to pick up the phone and call me or my team members to say, hey, we're not seeing this information right, or this looks a little weird. Where can you contact Oracle to be able to help us out? So that was also a part I definitely want to mention here as well.
Oh, I'm glad you did, because I'm curious, Casey, if that's more of a norm, because you've done it before, you know it can work, how much of it comes down to the team that you're performing it on behalf of versus the actual capability existing from an industry perspective?
It's a team thing, right? We work together as a team, and we have developed intellectual property that allows us to transform data and allows us to extract data very efficiently. But as we've talked about throughout the whole theme of this conversation, it really is, there's really two at the table here, and having just being in sync in terms of what we're trying to accomplish is really what's necessary here. Our secret sauce, if you will, but it does require engagement from our customers to make sure that we're able to meet their timelines.
Well, you both mentioned that strong leadership, both sides, PMO, tech, executive alignment has been a win. How did that shared accountability show up in the day-to-day work?
Our Chief Information Officer, Steve Travers, just checking in daily. How's it going? Me checking in with my team. How's it going? Having a strong project management team, trusting them to say, hey, you're leading this project. I'm here to assist. Understand where everybody roles and responsibility is to complete that full partnership in order to actually get this done. Having a team that cares is a major factor in it rather than showing up. Make sure, hey, I don't want to fail. I want to get this done. I want to get it done right. And I want to prove to everyone else that you can finish a project on time and early.
100%. And I think too, from having our CEO involved, he's not involved with every project. He did start the company doing data migration services over 20 years ago. And so he knows this really well. And knowing the commitments that we made and the exposure that this kind of a project would have, we made sure that everybody, from all of our developers, all of our team, all of our data mappers, everybody knew the importance of meeting these timelines. And so having our executive involved, as well as Deshan said, Steve Travers from the CIO involved, it really allowed us to work together and accomplish this.
Tell me a bit about the kickoff and goal setting component of the engagement. I'm curious what y'all prioritized in those moments and how that clarity really helps shape what you needed day one and the expectations going forward.
We knew what we had in next gen and that we were going to get it over. But then having the same interface team that was on this project, as well as doing our data conversion into Epic, we knew what was going to be there directly in Epic and what was going to be needed in the archival system. So having all that information laid out completely so then we could prioritize was able to allow us to move forward in a strategic manner. That way we're able to account to make sure that we have the most important patients or who's likely to be a patient and hasn't been seen by Broward in a certain amount of time. Having that information up front was very helpful. So our interface team was able to identify that, to say, this is our number one priority patients. This is number two. And this is everyone else who doesn't fit in category 1 or 2. And working with Casey's team to be able to say, okay, this is what we really need to make sure that we have in there, because this population is covered directly in Epic.
Couldn't say it any better. Getting that access was really important. So talking about kickoff, getting access right away was truly an important milestone in moving quickly.
And Casey, one of the hallmarks, honestly, of 314E is everybody feels like they matter for you. And so when you've got multiple projects going and you've got some of the newer, bigger pieces coming together, how are you also making sure that all of your clients feel like they are the most important one for you?
We are a small and mighty team, Sarah, and we work hard to make sure that they see that we're only working for them. And so it's really in our DNA here is that we put our customers first. And yep, we've got a lot of priorities going at the same time, but we have to meet our customers' expectations.
And looking forward, I'm curious how you're not only going to keep the momentum from what you've achieved together, what does the ongoing partnership and post-implementation iteration to a degree look like? Like, how do you do it differently for even better results and really have created a new operating model for each of your orgs by being so successful in your partnership?
With every project, we get better. And I think that we always learn something. None of these go perfectly smooth every single time. And we always have takeaways that we learn from those. And, I think some of the things that we have achieved in this project and a few others that we've delivered recently is that we can even move quicker than we thought. And so we did a previous project in 12 months and then Broward here in 5 or 6 months. Having sort of that knowledge of what it takes to work quickly and efficiently is just allowing us to go to market with a new message for our customers out there. It really is archive data at the same time as your go live.
What kind of sort of momentum did it set for your team and the confidence level upon which they were able to deliver as well?
It So from the Broward side, it really put 314E in as a trusted partner that whatever that they say that they can do and deliver, they really can back it. So as we map out what does life look like in the upcoming years for Epic, for Broward, as we plan our roadmap, they're a trusted partner that I could call Casey and say, I have this challenge. Can 314 be a potential solution to this? And this is something that is a great conversation to have with your trusted partners because sometimes as you go through the process, things that you see as challenges may not be your high priorities. But when you're able to have that ongoing conversation with your partners, you're able to really create a roadmap of what is the priority. So as we went live with Epic, we know that there's a lot of stuff that we have to do to close down next gen, Cerna, or as we finish archiving that with additional services that we may have. So there's going to be additional services that we're going to need. And since with 314, they really provided a great product, a great overall service, there's somebody that I will really pick up the phone and say, Casey, this is what I have in front of me. What does 314 have that could help us with this challenge? And that's what you really start really have a good conversation with.
Agreed.
And with knowing Casey, I think it's been at least a decade now that he and I have been connected. If he doesn't have that solution in his portfolio, he's going to help you find it with another trusted partner. And I feel like that's probably why through him for he continues to be so successful, besides the ability to deliver, is the ability to help you be successful wherever you are on your journey, for sure.
And that's what having a great partner is. It's really about being honest, whether you could deliver or say, that's not our strong code. It's really that upfront honesty. And that goes a long way from my side as working with an organization at the size of Broward Health. I really need partners who are going to tell me what the honest truth is. I could deliver it to you. I could do it in 5 months. I can't do it in 5 months, but here's some other options that you definitely want to actually take a look at. Having that honesty there goes a long term in your future partnerships.
Yeah, completely agree. Personally, having been in the business for a long time, I'm seeing this transformation that Broward Health is making too, and how they operate, from Deshan to Steve Travers to the CEO, Shane.
I love that you both shared this journey today. Before we close out, any last words of wisdom for the audience that's listening today?
I'll piggyback on what Casey has said. Now that you did it, you proved that you could do it. Now you can go faster. So when Broward went on this journey of implementing Epic in 18 months, the community was like, no way, no way. And we did it in 18 months. When we started looking at it, archiving, we did it in 4 months. It was so much more that you could go faster. So who knows what the future may hold.
Indeed. And I'll piggyback on what Deshaun says, is being honest about what you can and can't do is so important in our business, because the only thing we have to rely on is our reputation. And we've learned to make sure that we can deliver on what we say we can. And I think that's one of our biggest takeaways here too.
Well, it's so great spending time with both of you. Thank you for taking the opportunity to share what Broward Health and 314E did from the Museville Archive perspective and moving to really a shortened timeline in the migration to Epic, and shortened timeline and still getting there a couple weeks early. So thank you for sharing the journey for sure. It's pretty awesome to hear what a true collaborative partnership looks like.
Thank you.
Thank you for having us.
For those of you listening to Solution Showcase, that's all for now. If you found value in this, please share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we would appreciate it. Thanks for listening. That's all for now.